This is an introduction to using the patient plan of care with an integrated team approach. This System 1 document will support the multidisciplinary assessment of patients. It will enable all staff to use their professional skills and support clinical reasoning. This document means that the patient will have one multi-layered document recording the patient assessment over time. It will avoid the patient being asked the same questions by different staff. The multifactorial risk assessment is no longer a standalone assessment, but has been incorporated into the body of the assessment and is indicated by the prompts written in green throughout the assessment. This is an introductory video to familiarise yourself with the document prior to you receiving more in-depth training from a super user in your team. At the training you will be given detailed supporting information within the Patient Plan of Care Guidance document. Patient example is a lady with a recent stroke, discharged from acute care in Manchester to live with her daughter in Derbyshire. The first visit is by DN as the family found skin damage and reported this to the GP. A referral has also been sent to community therapy for a full assessment. Throughout the assessment, staff should use their clinical reasoning. The prompts in the document are there to guide, but not limit your assessment. Open the patient record and go to Care Plan. Select Patient Plan of Care 2019. Set a review date of 26 weeks. Please remember to also set the frequency for 26 weeks and link to the correct referral. Right-click on the Care Plan and perform Care Plan. Go to Reason for Referral and select the template. Enter the patient's perception of problem followed by the reason for referral. Record consent and record any other consent information such as does not want to share information with son. Record relationships that the patient tells you about here. Click OK to return to the care plan. Please complete the diversity monitoring component as normal, then go on to the patient assessment where you will find the patient wider assessment. Enter the history of presenting complaint, completing a detailed picture of what has happened to the patient and any impact on the patient's life using the prompts below. Next, enter information about falls. This patient has had no falls, however this is where you would document information details about falls if the patient had had them. The green prompts are part of the essential risk assessments of patients who have fallen or are at risk of falls and runs throughout the document, meaning that falls risks are always considered in all aspects of your assessment. There is no change to the FRAX assessment. Staff are to continue as before. Here is where you enter the patient's past medical history. Remember to use the green prompts to ask about allergies or hearing, etc. At the bottom of the page are quick links to recording allergies and respect information. If you already complete respect documentation, this button will take you directly to it. If you don't currently do so, don't start doing it. Click to page 2. Here is where you record how the patient is feeling generally. It is important to consider their confidence and memory, particularly in relation to patients who have fallen. Here is where you record current medication, if it is any different from the patient's medication history, which you can review here by clicking on the medication history button. Remember to include over-the-counter medication, recreational drugs and alcohol intake. Also record if the patient uses medication aids or has to have prompts from carers. Here is the environmental assessment. Remember to use the prompts in green highlighting any key safe information, hazards such as rugs or clutter, or access issues. Here is a social and personal history assessment. This is also where you document information regarding what care support is required or how patients manage personal care. The green parts here form part of the essential falls risk assessment. Click OK and return to the care plan. Next you would complete the core OBS, SCIM pathway, pain assessment as per DCHS policy, but this is not going to be shown in this video. Non-care plan activity is not appropriate for this person, so go straight to the problems and action plan. Complete the first box, Problems Identified. This is where you document a list of the patient's problems and an analysis of why the patient is in the situation they are in. You must demonstrate your clinical reasoning, explaining your treatment plan, and actions including any omissions. The second box is Actions. This is where you demonstrate your immediate actions, such as leaflets or advice given. You do not need to say "see care plan" because as a nurse you would go on to complete the care plans as per DCHS guidelines. Next, complete the patient dependency for all patients and the Rockwood Frailty Score for patients over 75, as you normally would. Remember that the Rockwood Frailty Score should also be reviewed at discharge. Click OK to complete the template and save the record as normal. An OT visit 2 days later following referral from both District Nurse and Manchester Hospital. The referral is triaged as priority 2 needing to be seen within 2 to 5 working days. The OT will perform the same patient plan of care 2019. Open the same patient plan of care 2019 and perform the care plan. Open the reason for referral and document the patient's perception of the problem. When you click in the box on the right hand side, you will see any previous entries that have been documented. Click into the reason for referral box and document why the patient was referred to your service. As stated previously, record consent and any new relationships. The OT would have checked that the nurse completed the diversity monitoring before opening the record and so would not need to complete this again. Next, open the patient wider assessment. You are just reviewing the fields to see if any new information needs to be recorded. You don't need to add anything that has already been recorded. You would only document if the patient tells you something different or if you have more details to add. You don't need to add to falls unless they have fallen since the last visit. Record any new past medical history. You only need to record any new information given by the patient. Click through to page 2 and document how the patient is feeling. If it is any different from the last entry, remember to consider the green prompts. The patient has had no medication changes, so move on to the environmental assessment. There is no change in the social and personal history, so nothing needs to be added. Click OK and return to the care plan. Next you will open the therapy assessment, which is where you will find the questions that had previously been in the therapy specific assessments. This is where you document your detailed assessment findings. You will see a list of buttons identifying areas of assessment. Use whichever buttons you think appropriate for your patient. Within each section you will find a list of presets. Use these presets as required or use free text if you prefer. For demonstration purposes we will look at transfers. Here we click through the presets and are choosing chair and sit and stand. The neuro assessment button is available for you if you need to record any more detail in your assessment. Click OK and return to the care plan and go to Problems and Action Plan. As before, record a list of the patient's problems and an analysis of why the patient is in the situation they are in. You must demonstrate your clinical reasoning, explaining your treatment plan, actions, including any omissions. Record problems identified and any actions. Save the record as you normally would. Physiotherapy visit day 4. Open the care plan by right-clicking on care plan and perform care plan. Select reason for referral, enter patient's perception of the problem and the reason for the referral. As before, use the right hand side to see any previous recordings. Open patient wider assessment to review previous entries. In this instance we have nothing else to enter, so we will go straight to the therapy assessment. Click into transfers and using the presets, select the method of transfer. In this instance you will see standing with rotunda, which we have typed ourselves rather than use a preset. Click OK and return to the care plan and open Problems and Action Plan. Complete problems identified and actions using the previous recordings on the right hand side. Where required, click OK and save the care plan.